Step one, check. And hit record. Hi, everyone. Welcome to breakout number 1. Thanks, Puck. I appreciate the kudos. We got to celebrate your successes. So I don't know if there are more joining us, but we are going to be doing just like we did before the break. So first thing is there anyone here who wants to volunteer to be the report out? Do the report out when we get back in the large group? Mark's joining.
I will volunteer, not enthusiastically, but I will volunteer.
Thanks, Darcy. Appreciate it. Welcome, Mark. Darcy just reluctantly agreed to be the report, to do the report out for our group when we join the main session at the end of the hour. So thank you, Darcy.
But Mark, if you really want to do it, I'm happy to, let you.
Eternally grateful, Darcy, so thank you. I'll owe you one.
All right. So we'll go with that. And I believe, Darcy, that, Jamie will have the board open. And so you will have the benefit of seeing the post-its. So you don't need to remember from, or take notes during this time. We'll have that up. Okay. So like Jamie said, I can screen share this, and I can do it 2 ways. I can either screen share it where you will actually get to work on the board as well and click on your own post-its and do all that, which is fun in some ways, but sometimes it's also intimidating for folks. Or I could share it like Jamie was doing, where I'm really running it and you all tell me what you want to type. Either one is an option. I like to give you all an option because sometimes people are like, I don't even want to mess around with lots of people in there. I don't know if people have a strong feeling one way or another.
I think if we do it in the way we were doing in the bigger room, will be better, just because it takes sometimes more time while you're typing it, and it kind of facilitate the discussion a little bit when everybody's contributing and somebody's doing the magic.
That work for me. Does that sound good to the rest of you? Can folks, if you are fine with that, give me a thumbs up or something? All right. All right, well, let me open our board here. And let's see, here we go. And I'll do it in presenting. Great. Okay. So it should have opened up for you now. And I'm going to zoom in here and move this. It's quite small. So I should have asked, was everyone here before the break? Everyone knows what we're doing? Okay.
I did notice during Jamie's presentation that I think we can individually control the zoom on our own thing too, unless my zooming is moving you around right now.
It is not.
So yeah, if people do want to focus in a little bit on their own screen, you're able to do that while Michael's still steering.
Yes, you won't be able to type in the sticky notes though. You'll have to either ask me to do that or put it in the chat, and I'm happy to do that as well. And we can go this route for a while, and if people are like, no, it's too frustrating, I want everyone to be able to do a note, I can reshare, we can try it that way. But all right, so we are assigned this, I don't know, teal, seafoam color one. And so we have 3 guiding principles, and I thought we would just start at the top with the first one, which is really people in crisis experience a welcoming response that is healing, trauma-informed, provides hope, and ensures people are safe. And so same thing, we have both, what does this mean or look like in practice? And then how might we measure this, whether this is happening? So, and feel free to take some time to think, and then just, let me know. You can either use the raise hand feature, you can use the chat if you want. People in crisis experience a welcoming response that is healing, trauma-informed, provides hope, and ensures people are safe. Claudia.
I think that a little bit to me means that the people who works at the crisis center looks like me. So we have BIPOC communities serving in all these multicultural communities, welcome people of BIPOC communities. So the people who works at these places look like me, understand who I am, where I'm coming from. That's what it would mean to me. And then how we measure that is just looking at the diversity, how much diversity are into the centers.
That is wonderful. And I'm just realizing that I only have view only access, which is not going to work for this. So let me try sharing it the other way and see if that works. If not, I think it might be a setting that Jamie has to modify. So let me just check real quick. Let's try a bunch of new one. Let's try it. Let's collaborate. Yeah, I think, Betsy, can you pop out to the main room and let Jamie know that my board is view only?
I just watched it said you had just turned into an editor.
Did it say that for you? Okay.
It said you, Michael, have been turned into an editor.
Where did you get that? I didn't see that. Okay, let's see here. It still says view only at my screen
Okay,
at the
hold
top.
on. So Michael, I will chat the group and let everybody know. This is probably the easiest way that you're view only on your board.
Hey,
Okay.
someone typed in okay.
That was me, Michael.
Oh. You mean you got saying Michael did that, but it was you, Puck? Because
I mean, I typed okay.
I can't type anything.
Oh, good.
It's really odd. I guess Puck, you're facilitating. I'm sorry. It's okay.
I asked somebody to pop in, Michael. We should have assistance.
Okay. I'm gonna try to close it and reopen it.
This is why I said I would not do this exercise. Pull out my intelligence here.
Let's try it again. Okay, we'll try it in.
I see that I'm following you, Michael, so I'm not.
No, I opened it in Collaborator, and now it is. I wonder if that was the deal. I wonder.
Okay, you're good, so I can let folks
Okay.
know you're good. Okay,
But I
thanks.
can't. All right. So I couldn't make it work where no one, you guys are going to see your own. But if you are getting distracted by all the little icons flying around with people's names, you can hide that. And I'm trying to figure out where that is. Let's see here. Okay, so if you, that's grids board, there is a view comments. Okay, so I don't know if you can see my cursor. Do you see this little like notepad looking thing next to the star at the top left? If you click on that 3 line and you come down to view and you click on collaborator cursors and you click it off, then all those will go away and they won't be distracting if that distracts you from things flying around. Okay. I'm going to try to capture. So Claudia, you were saying services are provided by people that look like the user. Is that
Yeah, that's good.
okay? And then we'd say monitor the demo graphics of the workforce compared to users, which I know is a really imperfect, impersonal.
Perfect.
But for now, I'm going to say users, and hopefully ask for forgiveness. All right, we're working here. We're in gear. Mark, see your hand is up.
Thanks. I think most of these, to me, from a what does it mean, relate to the workforce has to be trained well. That said, the way I would measure it, at least for the welcoming part, to me, this really gets back to the discussion from the main room that somehow we need to sample the users and get user feedback about, did you experience this as welcoming? Did you experience this as healing? Did you think that this provided hope?
Measure by getting user input on whether they experienced trauma, informed, healing. I'm taking some shortcuts here on our typing, but I hopefully feel, and if you feel like I didn't capture your words, feel like, no, that's not right, please tell me. I'm happy to correct them. Or you can also click on a sticky note if you want to try your hand at it. Darcy.
I mean, this kind of reminds me of some of the hospital surveys that, or a lot of healthcare wieners are required to complete for their Medicare funding. And there's a question on there that says that I felt like I was listened to and cared for with respect. So I wonder if that also might be a potential metric.
Okay. Is that also a measure, a separate meeting, or is that kind of a separate?
Another measure.
Okay. Patient surveys that ask people if they received.
Yeah, Darcy, that was exactly what I was thinking. This is very similar to
Yeah.
HCAPS and CG caps for clinics.
Mhm.
Yeah, Mark, I was thinking about caps for health plans.
Right.
The
Caps.
same thing. Yeah, we should look to that as a model.
And it's HPS, right? Caps. I'm trying to remember. I could see it.
It's caps, and then depending on what the area is, it has often has a different little sort of pronoun.
Okay.
But you got it, Michael.
Okay. Great. Lovely. Other folks? Okay. Ooh, I see the chat. Hang on, Puck. All right. Oh, Jane, sorry. I saw that you had to step away. I think you're back. Yep. So welcome. Oh yeah. Okay.
I'm back until I get a call back.
Okay.
So I'm just going to be its session.
Okay.
I have no control over my life.
No worries. I'm gonna add a little comment. Which it doesn't look like I can, so let's try it again. Why don't I have full options anymore? Okay. Usually I can add a comment, but I can't, so I'm gonna do this instead. Oh no, look, I can. Okay. So Puck raised the hand that not everybody finds surveys accessible. So may not reach those we most want to hear from in some ways. I think that's kind of, Puck, what you were saying. And not as a, that doesn't mean we shouldn't do it, but it may not be an exhaustive. Oh, look, Puck, you put the comment in there already. All right, I'll take mine out.
Yeah, I agree with that. I think that there's no one way to get all the feedback. And so part of the measures would have to have different ways
Yeah.
to get that more holistic understanding of people's perspectives.
I cannot be able to comment for now, but that's okay. I'm going to move these so people can see. Okay. Other thoughts about this one, guiding value, what it looks like, how you can measure it?
I think the other thing is that the experience of welcoming is also the like, for instance, if they're calling 988, that they immediately talk to someone. If there's a mobile response, that the mobile response people are immediately asking how they can help. If it's a facility, that the facility is welcoming in the way it looks, like it's well cared for. It's not a warehouse in some area of town that people wouldn't normally go to. So I think that there's also that physical environment, I guess.
Okay.
Physical being different depending on what the, if you're calling or coming or being.
There are lots of different things around physical space and creating trauma-informed welcoming spaces through the physical. So maybe space, physical space assessments.
So in addition to people that look like the user,
Okay.
what about people with lived experience, right?
Yes. How about
I mean, what's more welcoming than somebody saying, yeah, I've been here before and made it through?
Something we've been talking about in the lived experience subcommittee is the perception that somebody with my same experience or who looks like me, like that shorthand makes them a safe person. And I think that Mark said something important, which is about how people need training. Like I don't need
Mhm.
a non-monogamous, genderqueer, trans weirdo to help me. I need someone who's not going to treat me like I'm a weirdo for the things that make me myself, right?
Mhm.
And I know that some of that comes from like my white privilege, but I also, yeah, I think that if we get stuck into trying to find the perfect identity match as everybody else, then we are stuck there.
Perfection is the enemy of the good, right, Puck? In this case.
All right, so I am making a note, a comment in that one, because I think it's not, it's a both and. So I'm adding a comment, hopefully, Puck, to capture your sentiment around keeping in mind that it isn't necessarily about matching identities, but rather ability to provide culturally responsive services, as well as people seeing themselves reflected. So it's a bit of both. All right, let's see. We have these responses are different for different individuals. Is the system flexible? Can adapt individual needs? Okay, as a measure. And systems to support broad populations don't accidentally create barriers that keep them from doing that service. This sticky note over here, I'm not sure if
Yeah,
someone.
those go together, the two that you just read.
Okay.
I'm not sure quite how to articulate the second thing, but yeah, I don't know.
Yeah, I was trying to think of a way to. I think it's also a systems to support broad population. I think that's also what it means in practice, and not necessarily a measure. Is that right? Or were you trying to word this as a measure?
Yeah, maybe. I just don't know how to articulate a measure for
Oops.
the first thing.
Yeah, well, let's not worry about it then. Let's make a comment and we can figure that out later. Not sure if this is worded the way we want. We need to move to meaning or be worded to be a measure. Okay. Other thoughts from folks? Let's see. We have been almost 20 minutes into our hour. And we can go at the speed that we want. If we want to keep spending time on this one, we can, or we can move to the next one when there's enough support to doing that. Okay. That is a measure. Will people use the system again if they need to? That could be tied to a survey. Mark?
Yeah, I mean, it's a loaded issue, and so I don't want to have us drown in it, but the last word up here about being safe, I mean, this is a big deal, and I think we've spent a lot of time as a committee trying to figure out how to make people feel safe. The easy low-hanging fruit would be to say something like having a timely response in general is going to have people safer than responses that are not timely. But I think it also gets into the issues about use of rescue, use of protocols that explicitly defer to the 988 and the behavioral health crisis response system, as opposed to the police first responder response system when that's not needed and appropriate.
Maybe I can write that getting a timely response and more appropriately matched to need. Does that get at that a little bit?
Yeah, that was certainly the first part that I was trying to get at.
Okay, and then what was the second part?
I think for me, a lot of it gets to the discussions we've had about Can we really create a system where 911 passes calls off to 988 and we can avoid the use of police first responders when that's actually not called for and necessary?
I wrote consent. I didn't mean to write it in all caps, but my caps lock was on, and I'm not mad about it being in all caps.
People use the first responders when unnecessarily or when 988 would do. All right, I'll try to capture that. So one of the ways you can measure that probably is monitoring 988 versus 911 deployments. And
Part of that also is that there's really clear criteria when 911 actually is the right call to make, rather than having it be really subjective in the moment.
That's right. I was actually thinking protocols. I mean, I think in
Right,
the
yeah.
perfect world, we would have pretty explicit protocols. And then you could monitor were those protocols being followed.
Right, thank you. Alicia.
Thank you. Um, again, my name is Alicia, and I work, the program that I oversee actually provides crisis response within the 911 system. And so I think that for me, one thing that is really important is a very strong and consistent and clear collaboration between 911 and 988, because I think very often we recognize that we don't want people to not receive the care that they need regardless of where they call. And so I think for me, safe would also include that even if they are calling 911, that there are resources available within that system that support them in what they're asking for. That is aside from the emergency department or jail. So I think that the idea of having protocols and processes to ensure that there is consistent coordination and collaboration, that would be a way to build measurement. I just want, I think of if somebody doesn't know, because when you're in experiencing crisis or a loved one or someone you care about is experiencing crisis, sometimes you just think, well, I know 911. And so ensuring that it's safe for people to still call that number and that they're going to receive a level of service that we want everyone to have, regardless of whether it's 911 or 988 that they're calling.
Right. Perfect. Alicia, I hopefully you see I captured that a strong, consistent collaboration exists between 988 and 911 that further supports the right response. And then I added measuring coordination and collaboration to the measurement sticky. So hopefully that feels like it represents that.
Thank you. Yeah.
Let me check in. Is there anyone else that has any for this one, or do people want to move on and potentially come back knowing we have more time in March so we can revisit, or do you want to spend more time with this guiding principle?
It seems like we could move on and then we could always come back if we have time, just to make sure we get to all of them.
Okay. Before I shift then, Darcy, would it be helpful if we just identified a few key ones for this principle that you would share out, or do you want to just do
Sure.
that on the fly?
No, oh, that would be great. Thank you.
Okay, so I'm gonna do this little, let's see here, let's see, I used to be able to. Okay, well, I'm gonna use a pen and I'm going to, I will circle the ones that people want. So which ones would we like to highlight? Or would we like Darcy to highlight? Puck, since you initially were not upset about consent being all caps, would you like that one to be highlighted? All right, I'm gonna regroup and we're gonna move on to the next one. And I'm gonna say that right now is not a time for us. We're not ready to prioritize. So let's just move on. Okay, I'm gonna move the screen, so hopefully no one gets seasick. Motion sickness. Okay, so the next one is the crisis response system is intentionally grounded in equity and anti-racism. What does that mean in practice, or what does that look like, and how would we measure it? So grounded is intentionally grounded in equity and anti-racism. Darcy.
I'm not 100% sure how to say this, so maybe I'll throw it out there
Yep.
and then group can
Yep.
help with the right wordings. But it seems like the system needs to have a lot of awareness where there are risks for institutional, where current institutional racism exists, and what the approaches or initiatives or whatever needs to happen to mitigate that, because we're not starting from ground zero. So there are already systems out there, and we need to make sure that we assess those and we take care of those, and don't just, even if we built different systems, they're still going to have those old systems that will impact them.
Yeah. I think you said it pretty well. You're really talking around an understanding of how racism is built into our systems and structures, and what do we do to mitigate that. There are equity audit tools that look at systems, and so that could be a way of measuring. You'd have to scope it, but could add that as a measurement. Explore organizational equity audits to assess.
Yeah, and I think that not only in the beginning, but they're, on a regular basis, it gets re-examined to make sure there's not drift.
Yeah. And ongoing systems. Okay, Mark?
Yeah, I like to focus on sort of system institutional racism, and assuming that it's there and that you have to have processes ongoing to address it and not be episodic. I think the other thing about this, to me, when I think of equity, I'm reminding of a lot of what Jane has brought to the group, which is that everybody needs to sort of pay their share into the system. So if we have a crisis response system that's truly out there to save everybody, and certain people have means of paying, those means need to be brought to bear. And I think that helps the whole system.
So is that something like our system is truly accessible for all, regardless of ability to pay?
I think that's right, but I'm also trying to get at this part that people who use this system and have means to pay but don't need to actually pay their fair share. I think.
So can you say that again, the last part? Sorry.
I think the work that we've talked about, where up until now, if you've had insurance and you use aspects of the system, the insurance companies weren't called to pay for it. And I think we're now in a world where we're expecting that to change, and that's a good thing. We need to stay with that. That's the part. It's not just that everybody has access, but that all vested parties need to actually pay their fair share into the system.
Right.
Jane can probably say it better than I'm saying it, but.
Well, I have that there, and if anyone has any ideas to better capture it, certainly let me know or go ahead and edit that.
So I'm back. So under current law, Mark, a visit to to get a mobile crisis response or a visit to a crisis stabilization for somebody who has health insurance, that's the health insurance that we regulate, or a state employee or a school employee under PEB or SEB, that visit for purposes of their health insurance is treated the same as an emergency room visit. So has to be covered, no prior authorization, in-network cost sharing. So that's current law, but, right, we can't tell we can't tell Boeing what to do. We can't tell Microsoft what to do. And there's a process that's going on alongside this at the Healthcare Authority to send a report to the legislature at the end of this year about whether crisis services should be funded by like a covered lives assessment, where every insurer or every entity that covers people in the state of Washington would pay a certain amount per month to the state, and that would universally kind of fund the behavioral health crisis system. I don't know where that group is gonna come out in terms of recommendations by the end of this year, but that's sort of where we are with respect to how we finance a quote unquote universal insurance blind system. I don't know if that helps.
Jane, I don't know if this is accurate. I mean, I'm thinking in the Medicaid world, but so I translated that into examine funding streams by payer to look for parity or equity in terms of the funding resources coming in. I don't know if that matches kind of what you were just saying as a measurement level.
I think that's good enough for now.
Okay.
I think the other potential measure, and I don't know how we would measure it, but would be that pre-authorization or insurance authorization does not prevent someone from using the crisis system. Because that could get at some of what Jane was talking about the insurance companies that aren't regulated by the state.
Okay.
Or the I mean, the other big one is is Medicare, right?
Mm-hmm. Mm-hmm.
Yeah, I put a comment on the initial thing, the accessible regardless of ability to pay, that says users are not turned away from attempts to get help based on their health care. I know in Sean's situation, he went to some place that was just north of King County, and then they were like, no, you're on Apple Health. You already did things in King County. We can't help you up here. And I was just like, we're trying to get help, dudes.
All right. Anyone else want either, again, what it means in practice or measurement? Response system intentionally grounded in equity and anti-racism.
I want to bring up training again.
Yeah, I was wondering. I was like, what about training? What do you want to word about that, Puck? Do you want to talk about consistent and ongoing training around equity and anti-racism, et cetera, and then measuring, or what are you thinking?
I mean, my personal orientation to this is that you need to pay people enough to care. That's a big foundation. Maybe I mean, yeah, the crisis response system itself needs to be equitable in order to provide service that is equitable.
So I'm not sure if I could put people are compensated to participate. Is that a bit about the paid?
I mean, we need to treat our staff equitably in order for them to be able to treat other people equitably, is what I'm saying.
I'm gonna put that as a comment because I feel like that helps explain this. Need an approach that values and treats our staff equitably so they can then show up and treat and value users equitably. All right. Other thoughts or a measure for that? Alicia?
I was just gonna say that I know that law enforcement agencies have to keep track of how many people have gone through CIT training, and I know that that number constantly fluctuates based on the number of staff. But I think that if you're identifying as a behavioral health agency or you're an entity in which you're providing crisis services, then having like a minimum number of staff that you're ensuring are going through a certain amount of training, or having some type of schedule where like there is a specific type of training like they have for different types of licenses. Like I have, as a marriage and family therapist, specific types of licensure training that I have to take every few years to ensure that people are getting that cultural and equity training to better support people and have an understanding. I wouldn't say culturally competent, because I don't think that you can really fully know another person's experience. However, being able to have the humility to understand, I think, is important. And so I think that is potentially a measurable approach.
Yep. So I put that in the measurement as tracking participation outcomes, and then added the with clear requirements or expectations for participation. And that could be by role, like people need to know that they're expected to participate in certain trainings.
Yes, thank you.
Do we want to capture anything about like people are treated, I don't want to say this. Yeah, people receive high quality service regardless of their identities or something, and then talk about measuring disparities in outcomes or something, or is that? I'm just throwing that out there as an idea. But hi, Levi. Thanks for joining our group. We're just working on our second guiding principle. You're welcome to click and add on your own sticky notes, or most people are just kind of telling me and I'm capturing them, so however you want to. We're working on the run right now. The crisis response system is intentionally grounded in equity and anti-racism.
So, Michael, a question on your thought, because I was thinking about this when the big group was talking about the first one.
Mm-hmm.
What demographic information do we anticipate is going to be collected? Because in terms of what you're saying, to me, you would want to look at how many people actually have mobile crisis response dispatched, how many people, get a follow-up when the 988 line determines that more than just counseling is needed, and look and see whether there's disproportionality in it, right? So, but what I don't know is whether we're going to be gathering data about race or ethnicity or gender, because ultimately, it's who gets the service. So, or even, language. So the question is there a way that we can measure disproportionality in access to follow-up services when calling the 988 line isn't sufficient to de-escalate or to help the person?
Yeah, so I see Claudia, and I don't know, Claudia, if you want to respond to this specific one, but I did try to capture this idea of monitoring service and access and outcomes by demographics to monitor for disparities, and then made the comment that it will depend on the demographics we're able to collect.
Yeah, we'll say the follow-up or to that, yeah, the demographics and also, you know, language and user translators.
Mhm.
Because one of the things we want to make sure is that everybody, in terms to be equity, is the people who speak a different language, they receive the same amount of service and the same continuity of care than anybody else who does not, who speak only, you know, English or not. So
Mhm.
I think it's tracking the use of interpreted and services and type of continuity of care or services received will be important.
Mhm.
So I sort of added, language translation services, and then I added in Oregon, I'm sorry, I'm an organist, and we use RealD and SOGI. I don't know if those acronyms translate to Washington, but that's like race, ethnicity, language, and disability, and then sexual orientation and gender identity. Just as examples, I'm not making an exhaustive list, but just trying to illuminate that we are talking kind of a broad swath of potential demographics we might want to look at. We have about 18 minutes left. Do you want to keep going on this one for a while? Do you want to go to the next one and then come back if we have time? Where's the group feel energy?
Why don't we go to the next one if we're supposed to do 3?
All right, hearing no objections, we'll go. And also I'll remind us that, we can spend as much time as we want. If we don't get it all done or we want to revisit, we can request time in the March meeting as well. So the last one we have is the crisis response system is centered in and informed by lived experience. Puck.
I don't know why I'm the one raising my hand first here. Um, so somewhere early on in the process, someone mentioned the system being able to adapt to feedback.
Mm.
And I think that that's an interesting angle to look at. And then I also think about the problems that we got to just in this group in like, how do we collect feedback? What feedback do we get? And that's part of why we're doing this lived experience conversations thing. But I think that if we're asking for lived experience people to be in conversation with the system, if we're asking them to have the faith and energy to put into trying to structure and build it, we really need to be finding ways to listen to folks that don't harm them, that don't ask them to do an abundance of work without compensating them, that let them figure out when and how is the best time to give that feedback for them. And that can vary based on individuals. So just like everything else, I think it needs to be adaptive and flexible.
Mhm. Okay. So I have in there sort of that system is able to adapt to feedback. And I did call out user specifically, not exclusively. And then that systems are in place to collect that user experience with clear expectations for how it was used. And then I was going to maybe add the comments, and it's done in a way that honors people with lived experience for sharing their wisdom and that could include pay. Does that sound right?
Yeah.
Darcy.
I wonder if,
Nope, you're back on mute.
sorry, in kind of getting to a little bit to what Puck was saying is that there are people with lived experience who are part of the staff at all points of the crisis system.
And they are respected and supported.
Yes, for sure.
All right.
I think you need to, though, Michael, if you could put in there
Mhm.
that they're not just at all points of the system, but they're actually the part of the staff, right? So they're part of the employed people, not just volunteers.
All right. Is this another monitor workforce demographics and maybe employee surveys as a measure, or?
Well, it seems like you could do employment demographics, yeah.
Yeah, I was thinking about some kind of satisfaction survey to get at the respected and supported part.
Yeah, a sidebar story that I think is indicative. I went on a walk with a friend who his job was to inspect train tracks and make sure they're safe. And the people he worked for didn't want to spend the money to make the train tracks more safe. And so he kept getting pressure to say things were safe when they were not safe.
Mm,
And I think that that is the kind of position sometimes that folks with lived experience get put into, because like they're there hypothetically for their knowledge and information and expertise, but they're also responding to people
mm.
who rely on their reports to get money, maybe, and things like that. And so then they feel a lot of pressure. And so that is where I think we need to make sure that they are respected, supported, not pressured somehow.
Oh, this is a hard word for me to spell. And I'm gonna say not, I spelled it wrong. That was like the author, tokenized. And not tokenized. Or used to
Yeah.
funds without truly being supported to do their work in full scope. How's that? Other thoughts? Anyone else? Claudia, Alicia, Jane, Mark?
No, I think this looks good.
Alicia?
Sorry, I heard somebody else saying something, so I can wait if that person would like to go.
They had said they thought things looked good so far, so I think you're okay.
Okay, thank you. I think the other component, along with ensuring that there's access to someone with lived experience that is being compensated and that they are treated with respect and dignity, is the clear delineation of what their role is within a team. Because I have seen throughout my various experiences working alongside peers and people with lived experience, that often they become like a catch-all for all of these other services. And so I think just making sure that they are supported in the way of in the same way that any other professional is when they are working in a field of work, and not just placing it so that they're doing everything.
Okay, that's a little harder for me to try to word, so I think I don't know if this works. I said staff with lived experience have clear roles that align with their position or scope as appropriate, not just giving them everything. I don't know if that's
Yes.
right, but okay. Okay. All right. Darcy.
I am wondering if one of the ways under the meaning would be that there are proactive processes in place to get feedback from people who had negative outcomes, I guess. Like maybe they got sent to jail or were sent to an ER, and there's a way to get feedback from them on what could have happened better.
Heads up, we just at the top it says we have about 10 minutes left. So Darcy, I wrote that as there are proactive processes in place to get feedback from people who had negative outcomes. Which, you know, in terms of a measure, I could, you know, tie into what we already have around systems in place to collect user experience with clear expectations for how it's used. Okay. I see Puck added, people in crisis shouldn't have to be at their best in order to access the crisis system. They should have access to support trying to navigate the system. And support exists for people who need extra help. Okay, great. We took care of both. Other thoughts from anybody here?
I just added a note to Darcy's thing, which is, I think we all know that like if a system fails you, you might not be ready to try to make the system better.
Makes sense. All right. I'm gonna, I don't want that. Let's see. No. Move that so people can see. Same with this one. Okay. Other thoughts from anyone? We can also try to move back to the conversation about what we might want Darcy to highlight, because there's quite a few options. So if people feel like we're kind of done with our initial brainstorming, we could move to that conversation and just, it doesn't have to be uber complicated. We could just be like, oh, let's highlight 2 meanings and 2 measures in each of these guiding values. And that doesn't mean that not all of them are going to get counted, and it's just really just lifting up 2 maybe from each guiding value for Darcy to share. Yeah, Mark.
It seems to me that training has crossed over several of these that we've talked about, so
So maybe pick that one.
that might be a way of identifying priorities, is if the same theme shows up across 2 or more of these that we've looked at. And then the other one seems to be that somehow or another, we've got to think of multiple ways to get user feedback. And that we know that surveys alone won't do it, but many of these measures, I think, depend on getting feedback from the people that use the system.
You can see that I'm not super gifted with the pen, your version of this. But I'm just gonna circle some of these. People can certainly offer more, but I'm gonna circle a couple that feel like they're connected here to this one. So I think I captured 2 of what you were just suggesting, Mark. I think the other one that I think I've seen cross over is about the workforce and monitoring it. So maybe let's, so. These 2. I should probably do this one too. And then. All right, and then this last one I'm gonna suggest is just me being selfish. I love anytime we talk about trying to look at institutional and systemic racism, so I would totally be supportive of you all talking about that one. If folks, how do people feel about that? No? Okay. I don't see energy around that, so I will not, because it's not my breakout. All right, we have about 5 minutes left. Any final thoughts, questions, things you want to add? Does this group feel like you would want to spend more time in March on these 3 again, or more time on different ones? It might be nice to report out, Darcy, to have you say our group would want more time or not.
Yes, I will if they tell me.
I mean, if it were me, I would look at the other ones rather than these 3 again.
Let's see some nods. Okay, so it seems, Darcy, like the group, that while we got through all three, would certainly welcome the opportunity to look at some other ones. Okay.
Yeah, I know I should know this. How many guiding principles are there?
There are, let me go over here. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10.
Michael, I feel like when we were getting to these guiding principles, we probably had some of these conversations, and I bet we have that information that we could reintegrate here.
Yeah, so maybe on the work, were you in the work group that was developing that? Do you mean like those meeting notes? Okay. Darcy, maybe you can, sorry, I keep giving you more things to report out. That is a great input that maybe between now and March, staff can go back through some of the development notes to get to these and see if there are measures and kind of meanings that we can pull out too.
Okay,
So we can leverage that work that's been done by people already.
got it.
I love it. Okay, I know we have like a minute or two left, so I'm gonna keep asking you questions. Just process wise, how was this platform? Did it work out okay, or was it just too cumbersome for people?
It was fine for me. I don't know what it was like for you, since you were the one doing a lot of the typing.
That was easy for me.
Okay.
I know just like when we're planning these meetings and we're trying to talk about what's the best tool, it would be great to provide some input from this group, like, they didn't really like it, we need to come up with something else, or it was fine. So it sounds like it worked for Mark.
Yeah, I mean, I think it's fine. And I think if you feel comfortable being able to facilitate and write at the same time,
Mhm.
that works. The other option would be to like assign one person to do the writing and another person to do the facilitating. If some of your colleagues found that harder to do.
Okay, that's good. Okay. Well, we are done. So unless anyone has anything else to add, you can choose to leave the room early and just join the main room and listen to the comments that are happening there. There's only about a minute left. Or we could just stay together and then the room will close. We'll get a pop-up that says your room is closing. So totally up to you all. Or you could take an extra 2 minutes and do a quick bio break or grab some nourishment.
Alicia, are you here?
I am.
I just wanted to offer you some context because we've really spent a lot of this time with 911 not having crisis services. And so that is something that I really wanted to raise because I hear you being like, but we have this and we're going to wrap our brains around it. But until now, we've had some 911 involvement, but it has mostly really been very much distinct thing. And so your existence and your work, I think we are all excited about, and sometimes we are going to forget that it exists. So I just wanted to apologize for that. And if you're feeling a little weird about it, it's not just you, it is kind of our whole history, I think. Does that make any sense, Michael? I think that makes sense.
Yeah. Thanks for that additional context.
I
Okay,
appreciate it. Thank you. I appreciate the context.
thanks all.